Hello everyone, today's video is on strep throat. Strep is an abbreviation for group A beta hemolytic strep or streptococcus. And it's a bacteria that causes not only painful throats in children, but also a lot of stomach ache and headache. It is often even the culprit if there is fever in a child and we don't have any explanation at all. Sometimes they're completely symptom-free except for the fever. And so you'll see a lot of times in your child, especially if they're between the ages of 2 to 20, if you come into the office for an unexplained fever, we're almost always going to check them for strep. So I just wanted to teach you some of the telltale signs for strep throat so you would know that is reason to come into the office. Remember, so many things that affect children, including most sore throats, are viral. Please remember, we can't fix a viral process. It just has to run its course. And so for sore throats that aren't strep or aren't bacterial, antibiotics wouldn't help and would just actually cause a lot more trouble. Yeast infections, diarrhea, rashes, allergic responses, and most importantly, what we worry about, the overuse of antibiotics could drive antibiotic resistance, and that's a big problem. Here's a tricky thing with strep too. I've even seen some maybe not so high quality medical practitioners, they think that if we look in the throat and it looks really bad, it has to be strep, so you have to have antibiotics. And so a lot of parents come in with that same mindset, but that's actually not the case. Some of the worst looking throats I've ever seen turned out not to be strep. Mono, for example, Epstein-Barr virus, EBV, or infectious mononucleosis can cause some of the worst looking throats in the world. And in those children, it's a virus and can't be treated or cured with antibiotics. In fact, if you treat them with a penicillin-based antibiotic, they can have a really severe rash. And so that would be the worst thing that you could do for mono. So because of those reasons, because sometimes the throat doesn't look that bad and it is strep, sometimes the throat looks horrible and it's not strep. It's very important that we do a diagnostic test when the child's in the office. So most offices use now a rapid antigen test, which is generally between 90 and 95% sensitive, or that means likely to find it if it's there. Now, in my office where I work, we automatically, if the rapid strep is negative, culture the second swab overnight and hold that for 48 hours. So the culture is the old-fashioned, we take this swab and rub it on a sheep blood agar plate and then read it out at 24 and 48 hours. And what we're looking for is to see if that strain was hemolytic, meaning that it breaks down those red blood cells. So if you hold up the culture plate to the light, you can see through it. And there's a tiny little antibiotic disc, so there should be a zone of inhibition that it kills those bacteria around that little disc, and it's hemolytic. Then that would mean the culture was positive, and we would call the family back and start antibiotic treatment at that point. So I want to give you a few clues to know whether or not you should even come into the office for a sore throat. If your child has a lot of sneezing, runny nose, cough, almost certainly that's a viral process, okay? But if you look in the throat and you do see some white shaggy stuff on the tonsils called exudate, it's really just literally pus on their tonsils, they do need to come in. We need to rule out strep. The other signs are, you may see some, they're called palatal petechiae. That means on the back of the hard palate, you can see these tiny red dots, almost like tiny little flat blood blisters. And that's really basically what they are. Those palatal petechiae can indicate strep, the white on the tonsils, enlarged, bright red tonsils, and then these lymph nodes in the angle of the jaw here. So they're called the cervical anterior lymph nodes, and they're often really enlarged. They may be tender to touch. I mean, we're talking like a large grape size to almost golf ball size. They can be huge with strep. Sometimes children will even come in and it's difficult to turn their neck, and it's only because those lymph nodes are so inflamed that it makes it painful. So if your child has a new unexplained fever, we probably should see them depending on the circumstances. Now, if they have a typical cold symptoms, that's not unexplained. The fever's coming from the cold. Or if they have diarrhea, it's not unexplained. They have a tummy bug. But if they have an unclear reason for fever, if they have a really severe throat without runny nose, if a sore throat, if they have abdominal pain, if they have headache, that's a new sudden onset, especially if associated with fever, we should see them and we should check for strep. I can't tell you the number of times through the years I've had a patient follow up from the emergency department where they were seen for abdominal pain. And a lot of these cases even had expensive testing done, both laboratory tests and even CT scans of the abdomen and ultrasounds, and everything came back okay, but they forgot to check for strep. Several times I've done this in the ER follow-up visit, and the strep test was positive, which is great because that's a really inexpensive rapid test we can do, treat them with antibiotics, and they're fixed, which is great. Now, some people would say, you know, we are trying to avoid overuse of antibiotics. So even if my child has a sore throat, I give them Motrin, they seem fine. Isn't that okay just to not come into the doctor? Well, be careful. We really don't want to miss a case of strep because it can cause complications afterwards, like rheumatic heart disease or post-streptococcal glomerulonephritis and various problems. And so it is important for us to see your child if you suspect strep. And it's not an emergency going to the ER at 1 a.m. kind of, we need to see your child, but it is a when the office opens the next day sort of situation that you should call, and we should bring them in to rule out strep. And hopefully this was helpful because I do get a lot of questions about sore throats and when you do or don't need to come in. And by the way, this is one of the only reasons I would bring my own children into the office because I don't have a rapid strep test kit at home. And so when we do go into the office, it's usually to rule out strep because that's an important thing to do. Now remember, sometimes with colds, it starts with sore throat first and then you get the runny nose and congestion. So if you wanted to wait one day, if there's not a high fever, that's perfectly acceptable to see if it declares itself as a viral process. One more thing, let me remind you of this. Way back in the day, I can remember in my training well over 20 years ago now, that we would automatically treat siblings of known positive strep cases, just presuming if they had sore throat that they also had strep. However, since then there was a study done, and this actually isn't the recommendation any longer. Now, for every single child that's going to be treated with antibiotics, we would recommend they come in to get their own individual testing because only about 1 out of 4 of symptomatic siblings to a known positive case actually have strep themselves, just because viral pharyngitis or viral sore throat is so much more common. So hope this helps. Once your child's on antibiotics for now 12 to 24 hours, they may return to school. And we always recommend switching out their toothbrush, even though that may not have a huge amount of data behind it. It just seems like a good idea, and not letting their siblings eat or drink after them. We typically treat this with a penicillin-based antibiotic like amoxicillin, unless they're allergic, and then we use either a macrolide like Zithromax or a cephalosporin like Ceftonir. Hope that was helpful. Thanks.